Today is the 25th of January 2017 and my name is Amajit Singh Navla. I'm basically a civil engineer turned holistic and wellness coach. I changed from a civil engineer to a holistic and wellness coach after I could resolve, treat, completely cure my ulcerative colitis, which I had been suffering as an engineer between 1986 and 99. And it was only in 99 that I understood that the human body is capable of curing itself of any type of ailment provided you understand how to do it. So that's when I was introduced to the world of alternative medicine in 1999 through a newspaper article, and that newspaper article changed my life. And since 99 till 2017 we've been treating and helping people get well for various types of disorders, me and my colleague Madam Shilpa Khedekar. And we have our regular show on Astha channel, which is broadcast every day at midnight, past midnight, 30 minutes, India time. And it's been there on Astha channel since the year 2005. That's 11 long years. And we've been treating patients since the year 1999. And today I want to share two cases of spinal disorder. Because many a times our cases that we get are quite complicated, and people fail to understand how can they get better, because they've gone in for surgery for their spinal disorder and they've still not yet resolved it. So I'll make you understand that recently in the past around 6 months we could help two complicated cases. One of them was supposed to go in for surgery and another one who had gone in for surgery. And the best part was that they tried and they could not get the results. And when they came to us and they were telling us that, sir, we have not been able to resolve our spinal issues despite surgery. And I told them that I would need to go through your medical history before I can decide what type of treatment I have to do. But since that gentleman was in pain, and this happened recently in Patna, Bihar, where I was just visiting on the 7th of January 2017. And what happened is he was so desperate and he was so much in pain that he wanted treatment immediately. And I said, I cannot help you because I don't know why you've got pain. So then he told me he'd gone in for surgery. His surgery didn't work. So then he sent me his reports. These were his reports. If you see, the diameter of his spinal cord at L1, L2 is 19 mm, L2, L3 is 18 mm, L3, L4 is 18 mm, L4, L5 is 9 mm, L5, S1 is 11 mm. Now if you see, this is a spinal vertebra. I just made a rough vertebra. And then if you see the central core, you see the green area is 19 mm, 18 mm, then it goes to 9 mm and 11 mm. Can you imagine, if you calculate the cross-sectional area, it's around 2.83 square centimeters right on top, which is normal. Then it comes down to 2.54. Then it comes to 0.63 square centimeters. So if you see from L1 to L5, there is a reduction in the cross-sectional area by over 80%. So if there's a reduction of 80% in the spinal cord, can you imagine the compression of the spinal cord from all the sides? It's like being strangulated. And if the spinal cord is strangulated in one vertebra, you can imagine. We had a similar case from Norway, and in 3 of his vertebra, the diameter of his spinal cord is 10 mm. In this case, it's in one vertebra, it's 9, and in the next vertebra, it's 11. In that case from Norway, it was 10 mm in 3 vertebra. Now imagine what type of surgery could doctors do. The doctors can't open your spinal cord to remove the bone structure from outside. But in both these cases, the case from Norway was basically from India, but he was migrating to Norway and in October last year. And he did call back from Norway, and he gave me a feedback that despite the severe minus 6 degrees centigrade climate that was a few days ago, he was still comfortable. He was much better in Norway after doing our treatment than he was in the hot temperate climate of India. So he was sharing with me. He says that it's only when I overexert myself do I feel some pain in comparison to how I was in India. But now, despite the severe cold in Norway, he still is much better than he was in India. So you can imagine, at a temperature of minus 6 degrees centigrade compared to a hot temperature in Hyderabad, Pune and Bombay, where he was stationed initially. And These are the gentlemen that I met in Patna, whose report I have sketched over here. He had surgery and he had his spinal issue for the past 20 years. And he did his spinal surgery in the year 2005. And can you imagine, 2005 till 2017, he was still in pain. And despite one treatment on the 7th of January for hardly 5 minutes, and he gives me a feedback a few days ago that he has resolved his pain by over 30%. And this gentleman who is in Norway, who is 38 years old, and this gentleman in Patna is 48 years old. And both of them have had the same sort of spinal issue for the past 15 to 20 years. And all they could do is live in pain. And once they came in contact with us, within 6 months, now this case from Patna is hardly 15 days old, 7th of January, and today is the 25th of January. So you can imagine, 18 days. And I got a feedback a few days ago, it's all on my Facebook, that both of these patients have tremendously improved their life after starting our treatment. And the best part was, I did not even meet the client from Norway. We just received his reports. He was in India for some time, for some work, and he was going back to Norway. He sent us reports. We told him that we can help him. And he said, Mr. Singh, I don't have time in India to go in for surgery. Can you help me without surgery? I said, definitely. And I have not even met him. But we could send him his treatment while he was in India, and then he went back to Norway. And I just got a call a few days back from Norway that despite the -6 degrees centigrade temperature in Norway, his life has improved for the better. He's an Indian, he's a young software engineer, only 38 years old. And this gentleman, he's a mechanical engineer. He's working for a very big government of India department in a very big oil refinery in Bengal. I won't tell which location. And his company paid for his surgery. But despite having all the means for surgery, for all the expenditures, he was still not getting improvement despite going in for surgery. So these two cases that we have recently treated for severe spinal disorder, both of them have compression, both of them had spinal injury, both of them had desiccation, both of them had muscle spasms, both of them had spinal diameters reduced from normal 18 to 20 mm to 10 mm. It's all in the reports. I have all these reports. That's why I could sketch them out and calculate the cross-sectional area. What I'm trying to say is that when people try, we could help them get results. We would like to end this recording by asking, is it success or luck? Which comes first? You have to decide. Are you successful first and you got lucky, or were you lucky and then you got success? I would say success comes first, and then when you look back, you can say I was lucky that I'm successful in treating my problem. So I believe that success would always come first. Success will only come first when you decide to make a difference in your life. I would like to end this by saying that you may have suffered for so many years. You may have spent a lot of money. I also spent a lot of money between 1986 and 1999 when I was suffering with my ulcerative colitis. My salary was only 800 rupees and my bills of my hospitals were around 60 to 70,000 rupees when I would get admitted for 15 days because I would discontinue my medication. But it didn't I didn't lose hope. I didn't not want to continue trying. I continued to try until I succeeded, and I finally managed to conquer my ulcerative colitis in 99. And it's only then I realized that even all other disorders can be helped, provided the patient is willing to give it a try. So you're welcome to get in touch with us. We will give you our contact numbers. If you cannot come to Mumbai, where we are based, we can do a Skype, we can talk to you on the phone, we can get your emails, we can be on touch through LinkedIn or whatever method you like, we can get your email reports. But the best thing is that you need not come to travel to meet us, just like this client from Norway. I have not even met him. I told him, he was willing to come down to Mumbai from Hyderabad where he was visiting. I said, no need to come and meet me. Just show me your reports, and based on your reports, I'll try to help you to get well, wherever you are. And he's really surprised that you've made me fine. I'm back in Norway and I've yet to meet you. I said, sure, next time you come to India, do come down to Mumbai and we'll have a cup of tea. So, so the best thing is that you can get well provided you decide to get well, and the the change has to come from your side if you want to make your life better. So I wish you the best, and we are available in Mumbai. We teach sujok, we teach acupuncture, we teach time acupuncture, we teach Bach flower remedies, we teach aromatherapy, we teach tai chi, we teach diet, we teach nutrition. There are so many things that we teach, and we also hold corporate and individual lectures also. And we go out of India and Mumbai, and within Mumbai we also do hold many health seminars. So if anybody is interested in getting in touch to invite us to their organization or to their city or to their country, we are most open to it. And we may mention since 99 till date we've traveled to over 7 countries out of India, and we've stayed there for 40 days on invitation, because we don't believe in going for 2 days and coming back in a rush. We believe in being there to help the clients get well. So we've traveled all across Asia and Middle East and Africa also, East Africa. So this is a very good chance to connect with each other. I thank you very much, and I wish you all the best in life.